onto item 12 on the agenda, which is the HealthWatch COVID Patient Experience Survey Report. And before I ask Andrew to present, members should be aware, hopefully, that there was a response circulated on Tuesday, and that will have been emailed out to everyone. Andrew, over to you.
Thank you, Mr. Chairman, and thank you, members of the board. The first thing I wanted to do with the report, because one of the challenges we have with health and well-being is the length of time in between meetings. So from a contextual point of view, the survey that the report talks about was held between May and August of last year. Most of the report deals with the first wave, anecdotal evidence as we came out, but doesn't really touch on the effects of the second wave, the second lockdown, or anything like that. So it was completed before any of that sort of happened. And equally, one of the challenges we faced was for most of the period of time, we weren't able to actually get out and meet people in public. So we had to do things online. That obviously excluded lots of people who can't take part online, which is a challenge. But we still managed to get the highest number of survey responses of any of the health watchers across our patch. So although the numbers aren't huge, public testimony in this sort of condition really matters. So effectively, what's been our biggest health crisis in 100 years had the full mix of responses, and we hope the report reflects this. So we noted that there were more compliments than complaints from all the free texts we received. It detailed some heroic actions from various bodies, various people, but it also did highlight some disappointing outcomes in the first wave. And I think some of it is possibly to be expected because no one had a handbook of a pandemic like this. No one had been through it, no one knew where, and even still, we're still learning as we go. But I think the one thing that has sort of struck me in terms of the response, and I just want to thank especially all the people who have responded, and that's included Healthwatch England, Sir Simon Stevens' office, Health Education England, Public Health England, Thames Valley Local Enterprise Partnership, West Berkshire Council. I'm expecting a response from the Bob ICS or the Berkshire West ICP. We just haven't had that as yet, and there's one or two others we're expecting through, so thank you for that. But one of the things that I just wanted to highlight in all of this, in terms of, while there is lots of elements of success, we've also got to look at the fact that there are 240 plus families who were bereaved by COVID within West Berkshire. They include healthcare workers as well, who put themselves at great risk, which is more than entire countries in certain parts of the world like New Zealand, Vietnam, Taiwan, Gambia. So while we should rightly be praising ourselves, we should equally be saying, was there anything additionally we could do? And what we hope to do is bring this public testimony to the board to look at this, and also to actually start a conversation. This report is not meant to be a finished piece. It's meant to be the start of a conversation. And one of the things I wanted to highlight was the difference you find in how health and social care reacts to issues and incidents. And even last night, we had the Panorama program about patient safety. We had the National Audit Office report earlier in the week about COVID with various failings highlighted there, and even the CQC report in our own system about Huntercoon. And things keep repeating. We don't get to the end of it. Whereas you look at the aviation industry, it's now safer to go on a plane than it is to drive a car. And it's because they're using an open loop learning system. And I'm afraid it looks like health is still using closed loop systems. So instead of actually seeking to say, can we improve, where did things go wrong, we end up with too much time spent on deflection, on semantics, on unfair comparisons, and effectively not just getting to the hub of things, and often creating false narratives. So we hope that this would create a platform for West Berkshires to have a COVID pandemic learning, either a document, a forum, a task and finish group. And I think what it has done is it's highlighted weaknesses in system integration and ability of some partners to be transparent, and both give and receive feedback within an emergency situation. So I think those are really, really important. And I think, you know, if we don't learn from this, as was famously said, those who failed to learn from history are condemned to repeat it. Should we be faced with this again, more lives may be lost that don't necessarily need to. So it should be an opportunity to start the conversation, not silence it. And effectively, the challenge for us is to truly integrate the system so we don't end up with people saying oral health in West Berkshire is nothing to do with us. What is the difference between oral health, mental health, or physical health? The fact it's commissioned differently shouldn't matter. So if dental is failing, if phlebotomy is failing, or, you know, it is all the responsibility of the board members, a bit like Marmot says with the make every contact count. So we see the report very much as a starting point, not an end point. And equally, there will be far more to be learned once we genuinely get through the second wave, the vaccination program, and who knows, hopefully, COVID actually receding. But what we shouldn't do is just go back to normal and count this COVID pandemic as a one-off. That's what closed loop systems do, and it's really damaging. So that's all I really wanted to say in terms of the report, because I think there's lots in there, and I know people have read it and it's been updated. So happy to take any questions. Thank you.
Thank you, Andrew. And I should, I missed a chat, so I apologise for this. And I apologise to Zahid Aziz, who is in by phone. So Zahid, if at any point you have anything you want to raise, please just speak and we'll pause and bring you in, rather than going through that rather convoluted exercise of asking whether anyone who's telephoned in wants to speak at every point in the meeting. So members, does anyone want to speak to this item, or are you all cowed into submission by what Andrew's just said? Sharaz.
Thank you, Chairman. And you know, as I've reflected back to Andrew, we really welcome this report, and it's got very good insights in there around the elements of learning from looking at wave 1 and then wave 2 of COVID and future lessons, particularly for the NHS and integration. Apologies, our response is on winging its way to you, Andrew. You're actually going to get it hopefully in the next day or so. We've got some changes in our health system, so apologies, it's a bit slower than our usual response, but you will get that. I just wanted to pick up a couple of points from Andrew's report. And as he said, it was done early in wave 1. And even with wave 1, there were lots of lessons learned by the NHS system around how we approach wave 2. And some of those elements that were started in wave 1 was around the points Andrew has made around integration. So we had weekly health and social care meetings during the first wave of the pandemic to ensure that we were collaborating and sharing challenges around care homes, surge capacity, primary care, urgent care, PPE and safeguarding. I'm not saying we've got it right, but there was that will to get everybody in the room on a weekly basis to try and move some of this over. Some of our meetings that we have that are integrated in the Integrated Care Partnership may not have occurred, but shorter sessions were held to again relate and share challenges and escalate issues as appropriate. And I know people will understand this, but I think I need to reiterate that quite a lot of the health challenges around service delivery was based on social distancing measures and the extra requirements for infection control because of because of COVID and managing aerosol generating procedures. However, some of the services that Andrew's mentioned and are in the report around phlebotomy, memory clinic, they have now either gone back to pre-COVID levels or they are providing a mix of remote and face-to-face assessments. And one of the key things I think I need to point out as well is the NHS is very keen around the decompression of staff going through the different ways, which was again in the response, and the way a lot of things have been expedited in building that relationship for integration and moving forward. And Andrew, you're absolutely right. We need to keep learning those lessons, and this is not a one-off closed piece, we will keep learning and moving forward for this. So I welcome, sort of working with partners around moving these elements forward as well. Thank you.
Thanks, Sheraz. And Councillor Owen.
Thank you, Chairman. Really, it's just a very brief point indeed, and it is to just reinforce what Andrew has just said to us, that there must not be going back to normal. We've got to have that open loop. We have got to take the lessons aboard ongoing for years to come as to how we actually provide these various services, because nobody knows when we're next going to get something like this, and we have to be very, very open-minded indeed. And my personal thanks, and thanks from this side of the community, to Andrew for the piece of work that's been done.
Thank you, Owen. And the other A sharp, were your parents both musicians? Anyway, go on, Andy.
Definitely not musicians. Thank you for the report, Andrew. I think it's really helpful. It does highlight some really key information, some key learning. I think my only comment would be that it would be really helpful to understand how people's perceptions have changed through waves 2 and waves 3, because I think it's fair to say that we did learn as we went along, and a lot of things were picked up early on. So some of the learning is probably already in there. I think that, similar to Shiraz's comment, really, I think there's some things in there that happen as a result of things that were outside of our control. So as disappointing as they were around things like spending, quality visits, etc., there were certain things that we really had no choice in that immediate start of the pandemic. So it's just important to reflect that back. But on the whole, thank you for the report, and I think it does highlight an ongoing discussion, and the fact that it will be an ongoing discussion, I think, is really helpful.
And Councillor Doherty.
Thanks for the report, Andrew. And probably picking up on Andy's point, I'm sort of sat here thinking about all of the time that's gone since the report and all of the learnings that we've had since then as well, but also some of the national learnings that are coming out, some of the stuff, reports that we're seeing around mental health, etc. And I'm just wondering how we pull all of this together, because obviously I know here in West Berkshire Council, we're looking at OSMC are doing a piece of work to look back on review our response to the COVID pandemic, but obviously there's partners around the room. So I'm just sort of thinking, how do we pull all of these elements together to make sure that we have a comprehensive learning piece, but also a realistic learning piece with as many voices in it as possible? I'm just thinking how we pull all of this together, because I know as a council we're looking to do it. I know sort of from the CCG, and there's elements in that report I recognise, and I sort of think, yes, that there are elements that have improved, and there's other elements I think I wonder what will happen next. So I'm just sort of probably looking to you, Chairman, to how we actually pull all of this together, and at what point we pull it all together as well, conscious that we're still responding. We still have that element of response. People are still going through this. So how we, as West Berkshire, look at that here is my question, really.
Indeed, and I'll come back to that when I close up. Councillor Stewart.
I thought it was an extremely interesting read, Andrew. Thank you. There were some topics in here that you mentioned, dentists as one of them. I see a lot of conversation on social media all throughout the pandemic, and still ongoing actually, about how can I get an appointment with a dentist and that sort of stuff. So it's really good to see it picked up here, and I hope that this will mean that actually something can help to sort of start to address that situation. And I also really like the fact that you've got some of the good news stuff in here as well. So the, thank you to, and Birdwood surgery is mentioned, and it's often mentioned in really lots of positive ways. And I think that was really, really useful to give, a really balanced view of what's gone on. So I just wanted also to say thank you to Healthwatch for producing this.
Thank you. And Andrew, I'll come to you to wrap up in a moment. Don't see anyone else, so I'll just say that I think I recognise that there is learning, and we need to ensure that either we have learnt or that we learn. Clearly this is a first wave report. I think we need to understand where we are almost now, but in a couple of months' time, as restrictions are lifted, and there will be a learning curve out of that as well. Let's be under no doubt that we will need to learn what happens with the vaccination program as against the change in restrictions as we move to a perhaps more travel and other things of society. So whether it is the time now to reflect and start that piece of work that Councillor Doherty referred to, I'm not absolutely certain. But I think what I would look to Health Watch for is further reporting and further survey and further knowledge as to what the attitudes of our population are to second, third, for whatever wave, and more, and as much to the relaxation of restrictions as anything. So I think it's an ongoing piece of work that we will need to come back to. Andrew.
Thank you, and thank you for the comments. That's very kind. I think the things that really keep, having read this a million times, and also some of the comments, I think we have some stuff we can actually action. So Hugh O'Keefe, who runs NHS Dental South, has very kindly agreed to come and talk to whoever in West Berkshire, if only for an update of where they currently are. I note from long-term planning that one of the recommendations we sort of hinted at with who actually controls NHS dental in local areas looks like it's being taken up at an ICS level. So I think that's really positive, because I think what we were finding was we found lots of pressure on this, but anytime it was mentioned through our usual channels, we kind of got this, well, it's not us. And although that it's not meant to sound flippant, the problem is because people were so busy, if it genuinely wasn't them, it almost just got knocked off the radar. And to have people, you know, in pain with root canal and all sorts of other things, you know, having to wait months and months and months, and for health and wellbeing boards to say, well, it isn't us, just doesn't seem right. So I think those are the sorts of learnings where we've also got to learn from, you know, occasionally national government may not get it right, and can local adjustments be made? I didn't realise at any point that the planning team might almost become as important as the ICU team in terms of when we go forward and we're planning new estates and things like this, and ensuring that should a COVID wave reoccur, or as Public Health England point out in their response, you know, the actual flu pandemic that we were expecting turns up. So I think it's starting to relook at our system in a very different way as well, taking on all these learnings. And I absolutely agree there's some work to be done. Really, really important piece we highlighted with Health Watch England about the people who do not attend, which is a real problem for the hospital, who are currently massive numbers, but still with people not showing up. And we need to work out, why don't people show up? Has COVID instilled a long-term fear? And things that we touched on, like the workforce that Shiros mentioned, is, you know, if you bear in mind, we had the public worried about the health and social care workforce, and that was before the second wave happened. So that kind of burnout, and just we're asking people to do impossible things. I think looking at things like Health Education England, taking some of the young people who may have lost jobs in different areas and saying, look, health and social care is a long-term proper alternative. So for jobs that may or may not come back, it's not for everybody, but you start to actually look at the breadth. And when you look at how Marmot works and things like this, you start to say, well, if you want to be employed your entire life, come and work in social care. You will never be unemployed in West Berkshire. But it's how we sell that and how we market it. So there's lots of partnership work here, but I think we have to be brave, and we do have to have this open loop, and we have to build back better, fairer, and make sure we're better prepared. So thank you, everyone.
Thank you, Andrew. Members, so that item was for noting, so there is no vote to be taken. And I therefore now want to move on to